By now, you have felt the excitement here in Orlando, and IHI's 24th Annual National Forum is underway. The theme this week is defining moments, and there have been many during 2012, from the Supreme Court's affirmation of the Affordable Care Act in the U.S. to the hospital in Illinois that's celebrating a year without a single central line infection. Healthcare is changing across the world with a greater focus on staying healthy and not just treating the sick. Over and over, we're hearing how defining moments, large and small, are enabling healthcare organizations to improve the quality of care. There are so many programs and discussions here this week, from how to facilitate change in primary care to how to engage in end-of-life discussions. We begin our coverage today with IHI TV's Ed Hyland and a look at how leaders are moving their organizations on the journey to high reliability.
Whether it's key benchmarks or effective boards of directors or debating skill-based versus rule-based errors, there were a wide range of topics up for discussion and debate.
The workforce is generally trying as hard as they can to do the right thing. You have to design the work around them using scientific principles so they can get the support they need to do the right thing every single time.
It was a chance to focus on transitioning from theoretical to practical applications.
Synthesizing and creating the big dots with the different spans, such as the clinical effectiveness category, and really dissecting quality a little bit more has been very meaningful.
An instant online poll of attendees showed a majority of organizations represented said that quality is among their highest priorities, but also the recognition that healthcare rules alone won't get patients to zero harm.
You take the regulatory environment as a floor, as the cost of doing business. You have to meet those requirements, otherwise you don't get to operate and you don't get to pursue your mission. But if your mission doesn't have quality as its highest priority, then you're not going to be able to do your patients the best service going forward.
And defining quality was as varied as those in attendance.
In my hospital, we are progressing very slowly towards a culture of quality, and to gain more insight into how to deliver that culture to my staff. I'm learning a lot, actually.
More than 200 people here are focused on quality, safety, organizational culture, and process improvement methods. But you can boil it down to just a few sentences.
There's just a tremendous amount of work to be done. There's no magic. It's a matter of getting the right people and having the right commitments and just doing a lot of hard work. And this just reinforces that it's doable, but it's not easy.
For IHI TV, I'm Ed Hyland.
Thanks, Ed. Improving the patient experience was the focus of this session, led by Jason Leach from the Scottish Government Health Department. He introduced the concept of aligning safety with patient flow as an essential way to manage operations by decreasing variability. Leach says it's an all-system approach to improving patient care.
And that means deciding for real, actually calculating how many beds you might need, not guessing. We've guessed for too long. And then working out the smooth flow through your system.
What we're saying is counterintuitive, and we're really challenging the way we've designed healthcare. So we believe that we move into a new way of delivering healthcare systems, one that is safer and is more logical. But healthcare systems are based on how we've done it in the past, and for people to change, that's really difficult.
Case studies were used throughout the session to demonstrate that balancing cost and quality of care improves patient safety and significantly reduces costs. Whether this is your first forum or your 24th, one of the greatest benefits is the shared knowledge that you can bring back to your organization. We spoke with a number of forum attendees who are excited about sharing what they're learning here with their colleagues back home.
So to be able to come here and learn about new concepts, new ideas, what other people are doing across the country and across the world, it's really helpful to bring that back home.
The other thing that strikes me about the organization, there's an incredible willingness to share almost anything that someone's doing, and so I think it's really all for the betterment of all providers and health systems in the country.
I was really interested in just getting together with folks to talk about the impacts of change in healthcare reform and to get ideas around how to better integrate care into the delivery system.
There's so much discussion, it's very rich, and I'm here to learn and take back to my organization and make patient safety great.
One of the main topics during this year's mini courses is accountable care and how attendees can relate to their own organizations. This mini course explored accountable care by looking at organizations with a tradition of primary care and collective accountability for the quality of health care. Derek Feely from the Scottish Government Health Department led the session and says clarifying the aims of a system is the first step to improving accountable care.
We started today's discussion by talking about trying to build a bridge. And so if you're going to try and build the bridge, you need to know where it's going to end up. And so that's why being clear about the aims is important. And we were able, I think, in the discussion to agree a set of aims that we all thought made some sense. Again, built around the triple aim. So some aims that were about improving the health of the population, reducing disparities, some aims that were about improving the quality of care and improving the quality of life, and some aims that were about redistribution of the wealth and reducing the costs.
I think some of the big themes that came out are who should be the leaders in accountable care. Should it be hospitals and physicians' units or physicians' teams, or should it be payers or others? You know, who's actually got the interest of the whole population at heart, and are there some problems around conflict of interest?
We are joined by Dr. Nneka Mobison-Etuk. You are, thank you for joining us, as of August, new job, the Executive Director for IHI for African Operations. Your background, as I read, is in HIV management and treatment. Let's first start with South Africa and tell me what are, I'm sure it's daunting, but what are some of the biggest challenges and then goals there?
So our focus in South Africa, I think, is threefold, essentially. To date, we've been in South Africa for the last 8 to 10 years, and we focus on 3 main areas, specifically HIV, AIDS, patient safety, looking at both private and public hospitals in South Africa, and also maternal and child health. And I think one of the struggles that we're looking at now is how to really thread the knowledge from all the different programs that we're supporting and working with through our local partners to ensure that there's enhanced dissemination of knowledge, more knowledge around the best practices, around the challenges, the shared challenges that will only accelerate the learning across the different programs. So we're really trying to figure out how to essentially leverage vehicles to bring together people who are working in the field who can't necessarily use platforms that we typically use, like web-based platforms. Right. There are challenges in the African setting where a lot of times they may not have access to the internet. So think about new and innovative ways to really use different types of platforms to really increase the learning across the different.
What do you use? I mean, what's an example? I couldn't even imagine.
So we brought people, so we yearly have retreats where we bring our partners together to share their learnings. That's not fast enough. We need more frequent, more periodic scheduled vehicles like phone calls. Typically we've been using the web, and it's been an issue. One thing I think that we might want to look at is how to use kind of more of a mobile platform, a cell phone type platform to also share learning. Because that's worked in many different settings throughout Africa in different contexts. And it's one area we might want to explore, how to kind of use the cell phone, which has increased penetration throughout South Africa and other African countries, as a mechanism to share learning across the different boards.
With regard to just quality and safety in healthcare, a lot of the successes and challenges here in the United States are clearly different than they would be in South Africa. I mean, funding and staffing alone is so drastically different. How do you take the successes here and implement them, maybe on a different level and platform, but how do you take the successes here and bring them over there?
I mean, I think you start with the fact that even though our challenge, I think, in many African countries is lack of resources, lack of human resource capacity, there is still the science is still the same. So the evidence-based protocols essentially are still the same. And so our question is, how can we adapt existing vehicles, e.g. checklists, that have worked in the United States, that have worked in India, that have worked in other settings? How can we leverage that same concept, adapt it to the South African or the Malawian or the Ghanaian context, recognizing the importance of understanding a completely different and how it could work in a different environment, but adapting that same mechanism to spread change.
And do we bring Americans in the in certain areas over there, obviously, to sort of spearhead
Yeah, well, for us, country ownership is absolutely important, and sustainability is critical. So for us, and I think the IHI model is such that it's always about partnering with local organizations. So they're always at the helm of all the work that we do. And then as needed, they do have support from Americans, from other people, other Africans and other folks from the world, essentially, to support them either from a content expertise standpoint, from an improvement standpoint, just to enhance or further the learning in quality improvement.
And then the reverse of that, there are some wonderful success stories in low and middle income countries, perinatal care and whatnot. How do you bring those success stories and make them relevant here?
So this is a challenge that I think, even before I joined IHI, it's something that I'm actually very passionate about, because there are many parallels. If we look at what's going on in the United States, for instance, if we look at teenage pregnancy, if we look at some of the issues around perinatal care, there are many parallels in this country, and in HIV too. If you kind of look at what's going on in DC and compare it to what's going on in certain pockets in Africa, there's so many parallels. And we haven't done enough, as far as I'm concerned, to really glean kind of the insights and bring them over to the United States. And so we're actually talking about that at IHI now. What kind of knowledge management systems can we essentially build to ensure that we are transferring that knowledge? And we're doing it now. We're looking at kind of having an integrated strategy around maternal and child health that essentially ensures that we're leveraging the learnings across both and essentially driving kind of improvement across both by doing so. So we shall see.
A lot on your plate for a new job.
A lot.
Doctor, thank you so much for joining us.
Thank you so much.
Pleasure.
Thank you.
And coming up on IHI TV, we'll talk with an open school student about his experience here at the Forum. Also ahead, why Mr. Potato Head had a starring role at the international attendees meeting. And we'll examine the challenges of creating an accountable care organization. You're watching IHI TV.
For a letter to go.
In 2010, Cincinnati Children's Hospital Medical Center established the Community and Population Health Initiative as part of its strategic plan. It's a partnership between the hospital, community, and civic organizations in Hamilton County.
Community and population health is a strategic priority for us because we are really all about improving health for children.
The Cincinnati Children's Infant Mortality Team works to reduce preterm birth and improve infant outcomes. The obesity team is working to make progress in the field of childhood nutrition. By starting small in 3 targeted neighborhoods, Cincinnati Children's is developing prototypes for improving population health on a larger scale.
If we're able to move the dial and we can visibly show healthier communities, I think it's applicable anywhere.
You're watching IHI TV.
Reducing central line infections is among Blessing Hospital's most successful initiatives to improve patient safety. Blessing is a regional leader in patient and family-centered care, and as the largest hospital in Western Illinois, serves patients in 3 states. Recently, the hospital implemented IHI's Central Line Bundle and then incorporated their checklist into each patient's electronic medical record.
We shared results, and I think that's very important. We had a long run of months with 0 that was celebrated in the organization.
We had a Sweet 16 party when we reached a 16-month period with no central line infections.
My favorite thing is to see the graphs going in the right direction.
And I look at all of the learning that has gone on and the science behind it and what we're able to do for patients today, and I find it exciting.
People come from all around the world to attend the IHI Forum. This year alone, over 40 people are here from Singapore and the Middle East. IHI TV's Ed Hyland stopped in at the international attendees meeting to learn how they see the differences in the way healthcare is practiced.
They have come from far.
I'm from Oslo, Norway.
And farther.
I'm from Sydney in Australia.
48 countries are represented at the 24th Annual Forum. The international attendees meeting brings them together, and sometimes in unexpected ways.
Please start the clock now.
like this team-building concept involving an American icon, Mr. Potato Head.
Mr. Potato Head is a fun way of teaching the model for improvement through a team-based exercise where they'll get to actually experience what improvement is like in real time.
The fun exercise is part of the education these international attendees are looking to take home.
Introduce board training, so we haven't got there yet, so I'm going to the board session tomorrow. Also, the collaboratives, we haven't ran one of them yet, so I'm going to that session this week as well.
While we may look or speak or even act differently, what about our respective approach to healthcare? Is it different in different countries?
The only difference is the point of access and the payment methodology. Once a patient's in a hospital, it's exactly the same no matter which country you're in. So we actually have far more in common than we have that differentiate us. We got a socialized medical system, which is fairly monolithically public, as you probably know. But there's development going on. It is not all functioning as well as we'd like.
But differences melt away when you're networking over a plastic potato character. For IHI TV, I'm Ed Hyland.
Once again this year, IHI's Army of Blue Shirts is on hand helping attendees get around this massive conference site. All the blue shirts are IHI employees. There are over 80 of them here in Orlando, and they have been training for this week all year.
They start preparing us quite a ways before the forum, months ago even, and then in the weeks and days leading up to the forum, we have a lot of trainings, and then once we get here on site, there's additional on-site training. So by the time attendees actually start to arrive, everyone pretty much knows their role and knows where they're supposed to be, and usually makes things go pretty smoothly.
I've been to the conference before, and I was very happy to see the blue shirt because I have not yet registered, and that's where I was headed. But as soon as I saw the blue shirt, I knew I could get some help.
Up next on IHI TV, accountable care organizations. We'll talk with an expert on creating a functional ACO.
10 years ago, Children's Healthcare of Atlanta began a journey to eliminate infections at its 3 campuses.
What we try to focus on is preventing hospital-acquired or hospital-associated bloodstream infections.
The most recent campaign that we've adopted is called One is Not Zero, where one defect, one degree of variation, one error, one injured patient, etc., is not zero, and our goal is perfection.
Infection control is working system-wide.
Our bloodstream infection rate for 2010 was 1.8. In 2011, it was 0.7. We went over 190 days with no bloodstream infection, and that's the longest period of time we have gone without a bloodstream infection.
One of the big reasons why our improvement efforts around BSI has been so successful is because it is an absolute partnership between the quality department and our operational colleagues.
You're watching IHI TV. Since its inception in the late 1980s, the Picker Institute has built on the concept that patients must be at the center of the healthcare picture. Led by its original team of researchers, the Picker Institute helped introduce the first scientifically validated patient experience surveys. With the 1993 publication of Through the Patient's Eyes, the Institute demonstrated how a patient-centered focus would improve the quality of care.
That was the beginning of what became and what is patient-centered care.
The Picker Institute's mission to improve the patient experience took an even greater step forward in 2009 with the advent of Always events. In 2013, the Picker Institute will close its doors, handing off its programs to a stellar array of healthcare organizations.
We will always attribute this work of Always Events, Always Experience, and patient family-centered care for that matter, to the original work of Harvey Picker and to the contemporary work of the Institute.
If you haven't done so already, make sure you download the IHI mobile meeting app. You can access it on your smartphone or tablet, and it allows you to take notes on your sessions as they're happening and email them to yourself. You can also update your Twitter feed, review session descriptions, and read IHI presenter bios. If you'd like more information about the app, just visit the registration desk in the Los Angeles room. And to add even more to your forum learning experience, stop by the IHI Forum bookstore, where you can pick up books hand-selected by IHI to complement the conference program. Also available this week, select novels written by the keynote speakers and the chance to meet authors and get your book signed. Accountable care organizations have been up and running for about a year now, but they vary widely in delivery, and there is a great deal of debate about the quality metrics. This IHI session provided a one-year checkup to examine the types, hype, and market reality of ACOs. Consultant Jamie Orlikoff believes the challenge of creating a functional ACO lies in developing a system of incentive realignment that rewards value and not volume.
So instead of saying, the more I do, the more I make, I say, if I do the right things, and only the right things, nothing more, nothing less, that's how my patients will benefit the most, and that's how I will benefit the most.
Orlikoff says the key to any payment and care delivery model is standardized quality metrics that reduce the total cost of care. And still to come on this edition of IHI TV, our interview with open school student Kyle Johnson. Stay with us.
Saskatchewan, the land of the living skies, is the 7th largest of Canada's 13 provinces. Today, Saskatchewan is the first province in Canada to use a lean system of continuous improvement to achieve better care, better health, better teams, and better value for the citizens of Saskatchewan.
The goal is that every provider understands and knows what they contribute to this, and that every patient will know that it's all about them.
Thanks to a number of specific initiatives, such as the Saskatchewan Surgical Initiative, patients are already seeing better care.
Only once or twice in a lifetime in a career that you get to do a big change.
Saskatchewan is literally changing how patients access their care and paying off on the promises of better health and better value. Better teams means doctors, nurses, patients, and administrators all have a voice in how care is redesigned.
So yeah, the journey is a long one, but the size of the ambition is second to none, and that's what's so exciting about working here.
You're watching IHI TV.
Gunderson Lutheran is not just the largest health system in western Wisconsin. It is the largest employer in La Crosse County. Gunderson Lutheran has launched several initiatives, all of which tie into the IHI triple aim. The Care Coordination Program for patients with complex conditions is foundational to Gunderson's goal of transforming healthcare.
And it's a primary care provider is a hub with the nurse coordinators and social workers coordinating with multiple patients, families, and providers.
Fighting obesity is central to improving the health of the population. Gunderson has developed several nutrition and healthy eating programs to reduce obesity-related illness and keep healthcare costs down. Another way Gunderson is working to control costs is by controlling its energy consumption. They are on track to be 100% energy independent by 2014.
As a healthcare organization and as the largest employer, people pay attention when we lead.
We're joined now by Kyle Johnson. You are an open school student from Oregon. You actually are an MBA student who started the chapter at the St. Charles Health System. Why? Why so important?
So I'm just about done with my MBA, but it's an MBA in healthcare management through OHSU and Portland State Universities in Oregon. I got introduced to the open school through my university and saw the potential that it had to impact almost any organization that decided to take it up. Before that, I had come from the Marine Corps. I was an infantry officer for 5.5 years. And a lot of the change management techniques that I saw in the open school and the way that they looked at problems from a systems perspective, as opposed to blaming it on any single one thing, was very similar to where I had come from. And so I wanted to take that and transfer it to where I worked, and that's why I started the chapter there.
So what are your ultimate goals?
Right now, it's just to, I I've got a little 2 little kids at home, and I'm in grad school, and I work full time. So usually it's just to stay afloat.
But you spoke to me earlier about the IHI Open School actually being mandatory.
It is. Oh yeah, absolutely. So right now, what I want to do in healthcare is just to make things better at whatever level my potential will allow me to do. The executive leadership in our health system right now is embracing IHI as a mechanism for transforming the way we deliver and the way we think about healthcare. One of the things that we're looking at for 2013 is making the basic certificate a mandatory requirement for all managers and above across the health system.
Because really, I mean, quality of care, patient safety, this is not something that students typically get in their academic curriculum. Is that why you think it's so important, the Open School Diploma?
I do, and that's exactly right. It creates a common language for administrators to talk to physicians, physicians to talk to managers, and managers to communicate with their people at every single level. Most of these people, although highly educated, have no formal quality improvement training and really have no concept of what it means. They think of quality and they could think of charts, or they think of rules and regulations. They really don't think about what it truly means to create a culture of continuous improvement.
Tell me about the forum. You said this is your first time here. How's the experience so far?
It's amazing. I went to the Quality Leadership Academy last year. I wrote an essay, and IHI paid for me to go. It changed my life, and so this year my health system actually paid for myself to go, along with our chief medical officer, our chief financial officer, and our vice president of quality, and then several other quality oriented people in the health system. So we understand the value of IHI, and we're trying to use it right now as a tool to make a change.
And open school students, they are the future of healthcare. That's why it's so critical.
That's what I keep telling everyone. Yeah.
Terrific. Kyle, thank you so much for joining us. It's a pleasure.
Thank you very much. Appreciate it.
The IHI Forum is full of incredible defining moments, thanks in part to the over 200 IHI faculty members who lead the learning labs and scientific symposiums. On Monday night, National Forum presenters met with health profession students at the Gaylord Palms for an evening of conversation and networking. We hope you've enjoyed this edition of IHI TV at the Forum. Join us again tomorrow for another exciting wrap-up of the 24th Annual National Forum.